Welcome to Adapting Class. There's some topics, content areas, you just have to know them before you go and take the exams. One of them is the basic care and comfort. It's like risk management. It covers every subject area, but you have to be sharp when you're looking at the answers. It's what nurses do. You try to provide basic care and comfort for the patient. I have 20 questions. I'm not going to do all of them, just do 10 of them. But this is part of the Q Bank of almost 3,000 questions I've created. They're very difficult, but they're critical thinking. I will do 10 of them. These are all select or apply. So stick around and learn something. But I want you to pay attention to the topics that I use to create the questions. Try to master those topics. So let's get to them. The first one is pressure injury. Which of the following description is characteristics of stage 2 pressure injury? You have to know the type of pressure injury. And this is assessing the client pressure injury. So your buzzword for to answer this question is all knowing what is pressure injury and what is stage 2. And think about it and look at the answer choices carefully. That you have stage 1 to stage 4. Therefore, which description is stage 2? Full thickness, that word alone will make you eliminate this answer because it's not complete. Stage 2 is in the middle. It can be full, right? With loss of visual subcutaneous fat and slot. This is stage 3. Intact skin. It cannot be stage 2 if the skin is still there. You have to be in the middle. With non-blanching, this is stage 1. Partial thickness, right, is in the middle. Most likely, this is the answer. With exposed dermis appearing as shallow, open ulcers or intact ruptured vesicles. These sound like right answer right there. Let's look at the fourth one. Full thickness. Just by that word, eliminated. This is test taking strategy. By that word, full thickness and exposed of bone, we have stage 4. Therefore, which one is the right answer? Stage 3. Is C is the stage 2. Okay, I have an explanation that this is for my Q bank. And then she's teaching a group of older adults about preventing fall. You have to know something about fall at home. What are they going to ask you? What are the preventive measures, risk management staff to provide basic care and comfort? Which of the following home modification can reduce the risk of fall? So which of these, when you do it, is going to help the patient not to fall? Install grab bars in the bathroom near the toilet and shower. They're going to hold on it when you go in there. Excellent. Place aerial rugs on slippery floor to provide what? Cushion. This is a trap. You don't want to have rugs on the floor. They're going to trip on it. Even though I say provide cushioning, is wrong. Don't pick it. Ensure adequate lighting in all rooms, especially stairways and hallways, right? If I can see and I see area rug, I run away. Therefore, this is good. What else? Keep frequent, keep frequently used items within reach. If I can reach it, I don't have to get up and walk and trip on the floor. Excellent. Use, right, non-slip mat in the bathtub and the shower because that place is wet. So if they non-slip, you can step on it so that you don't fall. Rearrange furnitures, right, to create clear, unobstructive pathway. It's the same thing as the lightning. Ensure the use of soft, loose-fitting slippers without firm soles. This is the same thing as number 2, trying to trap you. You shouldn't wear anything. Slippers, whether it's loose-fitting or anything like that. Negative. So don't pick it. So answers are A, C, D, E, F. Master 4, and then you'll be fine. Any question they ask you about 4, you can answer it. Number 3, a nurse is preparing to perform tracheostomy suction for a client. Which of the following steps should the nurse include in the procedure? Select or apply. Perform an hygiene and apply sterile gloves before starting the procedure. This is a sterile technique, so you should do that. Patient need to be pre-oxygenated. Insert the suction catheter while applying pressure. When you insert, you should not apply any pressure, and you should limit suctioning by 10 to 15 seconds. You should not lubricate it with normal saline. It's not good. And allow the client to recover from it. 30 to 60 seconds is good. You should not suction. You see, suction the tracheostomy tube first, then mouth and nose using the same catheter. There will be cross contamination, right? This is not good. Monitor the client oxygen saturation, heart rate through the procedure. So these are key things you should be doing while you're going through the process, right? This is the key. Separate catheter should be used when suctioning the tracheostomy and the mouth to prevent cross contamination. But this is what you do. The pressures can change. Sometimes you use 100 millimeter mercury, depending on the age of the patient. But adults is 100 to 120. You should not suction more than 10 to 15 seconds. All these things you have to know such an issue. Number four, the nurse is evaluating a client understanding of sleep hygiene. Know about sleep. Which of the following statement by the client indicate that teaching was effective? That means you've taught them something. They know about sleeping. What is good for sleep hygiene? I will go to bed and wake up at the same time every day, even on weekends. Excellent to keep your routine going. I will avoid caffeine in every meal at 4 to 6 hours before bedtime. It will keep you awake, so avoid them. That is good. I will use my bed only for sleep and not for watching TV. If you're not going to fall asleep, don't go to the bed. If I can't fall asleep in 20 minutes, I'll get up and do quietly activity until I feel drowsy. This is the same thing as number three. So you should do that. I will make sure to exercise vigorously right before bedtime to tire myself out. As you can see, test taking strategy. Why will four be right and five be also be right? He said, if I can't fall asleep, I'll wake up quietly and do some light activity. Five said, I need to do vigorous exercise before going to bed. Wrong answer. And look at F. I will create a relaxing bedtime routine like taking a warm bath and reading book. This is contraindicating the number five. I will keep my bedroom dark, quiet, and cool as much as possible. Lower temperature, dark environment will help with sleeping. So these are all things you should be teaching the patient to do, and he's saying the right thing. Okay, those are sleep hygiene. And next is determine whether clients require a mechanical lift for safe transfer. Which of the following client will need a mechanical lift? This is a content. Mechanical lift is used for patients who cannot cooperate. You talk to them, they cannot help you, and then they cannot bear weight. That's all. So I can't cooperate, I can't bear weight. So these are the two things. So look at each patient and see if they can cooperate or they can bear weight. A client with bilateral lower extremities, paralysis, and no upper body strength, it can bear weight with this. There's no way, right? A client who is mobility obese and unable to assist transfer, he can help you. That's the problem. A client who is unconscious, right? No, see, a client with severe arthritis who can stand but struggle with pain during movement. He can bear weight. Since he can bear weight, you should let him and he can follow commands. So you can just assist them, but you don't need mechanical lift. A client who is unconscious or minimally responsive, I cannot bear weight and I can follow command. A client who is cooperative can bear weight but need guidance. You don't need to lift them up. A client recovering from major operative surgery and restricted from bearing weight. So you see the content, how you can answer question. Two things according to the buzzword. You can bear weight, you cannot bear weight, and you cannot follow command. Those are the two you use to find out which one are your right answers. Number six, and this is evaluating the use of oxygen delivery device for various clients. Which of the following clients are using an appropriate oxygen device based on their condition? You have to know oxygen devices and which condition can you use it. Each of them has appropriate use of it. Number one, right? Number one, the key aspect, right? The client with mild hypoxia using nasal cannula. Nasal cannula, you can use it if your saturation is like 95, 96, 97, mild hypoxia. You're doing the right thing. The client experiencing acute asthma attack need something aggressive, non-rebreather can give you up to like 10 to 15 liters and 100% oxygen. This is good. A client with chronic COPD with the ventricular mass that can provide precise oxygen delivery. Ventricular mass is good for COPD. You see what I'm doing? That's the way you should go about it. A client recovering from surgery require high flow oxygen using a simple mask. Simple mask cannot provide high flow oxygen. It can give you up to 6 to 10 liters. It's not good. A client with severe ARDS cannot use nasal cannula. A client requiring 100% oxygen delivery, non-rebreather is the best mechanism. So know each set of device and what they can do. This is content right there. So I give you explanation. Which of the following assessment strategies are appropriate for specified clients? Select or apply. And then she's performing physical assessment on client of different age group. How do you assess them based on your age group? You have to know this. So this can be very difficult. It's a difficult question, but I will show you how you can answer. Know each group, toddler, preschool, what they need, how to cooperate with them, and you can answer this question without any problem. So the first one, encourage your preschool age child to sit quietly and remain still throughout the entire assessment. Preschool, for them to sit down, negative. They will not sit down. They will be like up and down. Preschooler won't do that, right? They can stay still. Allow a toddler to hold a stethoscope before auscultation to reduce fear. The best way to reduce fear from them is let them touch it. Know that you're not going to harm them. Explain each steps of assessment to a preschool age child using simple, clear language, right? Simple, clear language. They will understand, no jargon. They will let you do whatever you want to do. Ask a school age child for permission before touching them during the exam. The school age people, they need privacy, right? They need privacy. So you need to provide that kind of privacy as much as possible. But I will show you something. There's a reason why I choose that, but I will show you it's not the right answer because you don't need a lot of permission, right? Asking a school age child for permission before touching them during the exams, you can get them involved, but not every time you have to ask them, I got to touch you, right? So that's the wrong answer. But I selected it so that you can see what I wanted explaining to highlight that. You don't need to ask them all the time. You can get them involved, but you don't need to like ask them every permission. Performing the least invasive is good for infant. Otherwise, if you do the invasive procedure, they start crying, you lose the opportunity to take care of them. And then conduct head to toe assessment without parental presence for a teenager who require privacy. This is good, right? Teenagers, they want privacy. Let the mommy step out, right? But pay attention. School age, you can ask permission, but not every time, right? Asking before every time you want to touch them, you want to ask permission to do that. You can get them involved, but you don't have to do that all the time. So this is the key things you have to do when you're taking care of these patients. And number 8, a nurse is evaluating a client's understanding of home oxygen therapy. Which of the following statements indicate teaching has to be effective? Home oxygen, right? Home oxygen. How do you teach them so that there's no fire? Most of them are COPD patients. What do you tell them? This is key, right? I will keep my oxygen tank at least 5 feet away from any heating source. It's good so that there's no fire. Petroleum gel is bad. I will use a petroleum product like Vaseline to moisture it. It's very combustive. Your face will be caught on fire. Don't use it. I will clean my nasal cannula and tubing regularly as instructed by the healthcare provider. Nothing wrong with it. Cleaning that. I will make sure not to smoke or let other people smoke near the oxygen. Excellent. It's okay to adjust the oxygen flow if I feel short of breath without consulting. You should never do that. You always call the doctor because too much oxygen can be toxic. I will notify my healthcare provider if I experience shortness of breath. It's a good thing. Install your oxygen in a well-ventilated area so that it doesn't cause fire. Is this? Please know about this oxygen therapy, fire, and everything. These are some of the things you teach the patient. And let's provide care for a client in end stages of dying. You have to know this is one of the basic care of comfort, end stage of dying. There will be parent asking you what to do. I have a bunch of videos on this, on end stage of dying and basic care of comfort, end of life care. Just watch it. Which intervention the nurse will teach the family to provide comfort to the client in final hours. Select and apply. The key thing is they're not going to eat. Everything is going to go down. Provide what end of care. If they need pain medication, give them. Don't be shy. Talk to them. Give them a fair way. Instead feeding tube for adequate nutrition, you force feeding. Don't do that. Allow client to refuse. Excellent. This is contradicting each other. Therefore, B is the right answer. Talk to the client, normal. Massage them and read for them. This is all acceptable. And this is caring for a client with the chest tube placed 6 hours ago. Which of the following findings are concerning and require immediate intervention? You know about chest tube. I have a full video on chest tube. You have to know what happened at each segment of the chest tube. That is what the board will ask you. Every time you see a chest tube question, it's predictable. It's not magic. No matter where you go, whatever Q bank you use, it's the same thing. They have to give you the same content. Just know the segment of each area of the chest tube. And when you see a question, voila, it's right there. Continuous bubbling in the water cell is not good, right? It's not good. It's not good. So don't do that. So which of these concerning continuous bubbling in the water cell is a bad thing, right? Is a bad thing. Sudden increase in output, all of a sudden, boom, increase in output is also bad. Absence of throttling, that means there's no communication. When you breathe in, nothing is going through the tube. Yet there have to be rise and fall of the fluid in the tube and the water seal chamber as you breathe. That means there's something wrong. We got to assess the patient. Intermittent bubbling in the water seal 6 hours after chest tube placement when the patient cough is okay. It will go away. Subcutaneous emphysema may indicate pneumothorax, but 6 hours after insection, it may be expected. After, if it's 24, 48 hours, yeah, we got to investigate. So these are what you should be worrying about. This is 10 questions. Basic care of comfort. All the topics I mentioned, I want you to go read about them, know them. I have videos on them, content area. I put them together to create a question. Good luck and thank you for watching. Best of luck. Bye.